The term encephalitis basically means inflammation of the brain. When the inflammation of the brain is a result of infection from herpes virus, you call it herpes virus encephalitis. This is a very rare condition affecting 1 in a million people. Once a person has herpes virus encephalitis, if it is not treated, 70% of individuals will not survive this infection, meaning the mortality with this infection, if left untreated, is 70%. EEG is a useful test in making a diagnosis of this condition. Of course, you don't make the diagnosis just based on an EEG. You have to take a good clinical history, examine the patient, and then use other investigations such as an EEG and an MRI to support your diagnosis. EEG is approximately 84% sensitive, meaning that if you do EEGs in all patients with herpes encephalitis, you will be able to pick up specific abnormalities in 84% of these individuals. And it is 32% specific, meaning although those findings are seen in herpes encephalitis, similar findings can be seen in other conditions as well. Let me give you a very typical picture in somebody who has involvement of the brain. So you can see the inflammation in the area called the hippocampus here. You can see part of the temporal lobe involved. You can see part of the insula involved. You can also see some frontal lobe involvement. So the abnormalities on the MRI typically are on one side but can affect both sides of the brain. Now let me show you a typical EEG here. This is an EEG from a patient with herpes encephalitis. So this is an 80-year-old man who presented with a new onset seizures. His wife reported that for the past few days he had been very confused and disoriented. He was having trouble carrying out work at home and was having difficulty even feeding himself and bathing himself. And then the seizure occurred, and that's why he was brought into the emergency room. So this is an EEG that was done on this individual. So just to give you a very quick introduction to the EEG, all the odd numbers here are recording from the left side of the brain. The even numbers are recording from the right side of the brain. The alphabets tell you the location of these channels. So FP is frontopolar, C is central, P is parietal, O is occipital. So O1 is occipital, and since this is an odd number, recording from the left side. Now what I would suggest is compare the left side of the brain with the right side. So compare all the channels that end with an odd number with those with an even number, and you will see the difference between the two hemispheres. These green lines are separated by 1 second. So we see quite a significant asymmetry between the left and the right hemisphere. The left hemisphere is not normal either. You do see slowing. So between those two lines you can see slow activity. But on the right side it is way more prominent. These sharp wave discharges that you see occurring almost every 2 seconds, sort of in a periodic manner, are called PLEDs, which stands for periodic lateralized epileptiform discharges. So there is an asymmetry between the left side and the right side. Both hemispheres are slowing. The right hemisphere also shows these PLEDs. Now let's move on with this EEG. You can see some muscle artifact that is there. And these sharp waves, sometimes these appear very periodic, sometimes they are not as periodic, what we call quasi-periodic discharges, meaning almost periodic but not quite. This is a bad ECG electrode, so let me just take this off. So rarely you can see the epileptiform discharges in both hemispheres. Many times you just see it lateralized to the one hemisphere. If you recall the MRI that I just showed you, you can see that these correspond to the lesion on the MRI. Now if you monitor these periodic discharges long enough, the patients have a high chance of getting a seizure, so these periodic discharges can build up into an electrographic seizure. I believe that's what happens with this patient as well, and here you go. So we are looking at these discharges. These start getting more close and close to each other, and then you see this evolving rhythm that is in the right frontal central region as well as the right temporal head region. And you can see an electrographic seizure. Compare the left side with the right side, then compare the left side with the right side, and you can see this seizure. An electrographic seizure has a clear beginning. As you can see in this case, there is a clear beginning. It has a clear end, as you will see down the road. There is an evolution in frequencies, and there is an evolution in amplitudes. And the seizure is pretty much gone, and the PLEDs, or periodic lateralized epileptiform discharges, are again seen. You should be able to differentiate PLEDs from eye blink. These are eye blink artifacts, and these are PLEDs in the P4O2 region and T4T6 region. Those are periodic lateralized discharges. And the seizure is over. This is just ocular flutter, just fluttering of the eyeball. So this is not PLEDs. So the bottom line is this patient was treated with 3 to 4 weeks of intravenous acyclovir and did remarkably better. Many times the PLEDs will persist, sometimes for weeks, before the even after the treatment has been completed. You have to be very vigilant to try to identify seizures, educate the patient, educate the family. You may want to repeat another EEG, and similarly an EEG was repeated in this case, which showed that the PLEDs had disappeared, but some background slowing specifically in the right hemisphere had persisted. If you see these kind of discharges, PLEDs, herpes encephalitis is not the only condition that causes PLEDs. Other conditions to consider is a brain abscess, an acute stroke or a subacute stroke, somebody who has a contusion, some kind of a trauma. So any insult to the brain has a potential of causing PLEDs. So PLEDs are not specific for herpes encephalitis. Their specificity is only 32%, but they are 84% sensitive. So it's a very useful test if you are investigating somebody with a suspected herpes encephalitis. I think I will stop here, and if you have any further questions related to this case, or if you would like me to present any other EEG pattern specifically, please write in your comments. And if you like this video, please give us a thumbs up. Thank you.